This is Living Healthy with Your Health Potential, where we explore your options for better health. Brought to you in association with The Woman in You.
Hi, welcome to Living Healthy. I'm your host, Sheryl Worthington Turgeon. Biological medicine is becoming popular all over the world. It combines cutting-edge technology with natural and holistic ways of evaluating and treating illness. Our guest, Dr. Frank Pleus, holds degrees in both medicine and dentistry using biological medicine. As part of the Biological Medicine Network in North America, he teaches naturopathic healing methods and whole-body dentistry to providers around the world. We caught up with Dr. Pleus when he was speaking at the Biological Medicine Network conference held in New Bedford, Massachusetts, in connection with the Marion Institute. This is the first of 2 interviews with Dr. Pleus, and it focuses on biological medicine. Welcome, Dr. Pleus. We're so happy to have you on the show today. We want to talk with you a little bit about biological medicine. Could you tell us what it is? Give us a good definition of it.
Integrative medicine combines allopathic Western medical knowledge with Eastern and Western traditional medical practices based on more than 100 years of medical experience. So integrative medical practitioners focus on the patient as a whole entity. They do not provide a diagnosis of an organ alone. We concentrate on a patient's interrelated system and his individual body, mind, and soul concerns. So what's very important for the biological practitioner that we learn about a patient's capacities to regulate his systems. If needed, we even determine what is needed to restore these systems. We look at the levels at which the organs are functioning. Is the autonomic nervous system balanced or in stress? We consider the individual's constitution and check the functioning of the metabolism. We factor in that person's genetic history because the genetics might be interesting and important for us to know if it's having an impact on the capacity for detoxification, or is the undergoing oxidative stress related to this genetic history he has. So we relate systems, organs, tissue with capacities, levels, and constitution, as well as emotional, mental, and social influence on the body's well-being and regulation. And all diseases are multi-causal, so we do not view disease as having a single cause. We think of the body as a container with substances in which the organs interconnect and communicate. And the container substance is known as the mesenchyme or the matrix, or some refer to it as the Pischinger space. So it's the environment in which the organs work together and regulate your health. Imagine a pool of water with molecules swimming in this water like salt or chlorine. Well, the mesenchyme is like that water in the pool or container. When a patient comes to us, their container of mesenchyme has become polluted by bacteria, microbes, or virus loads, and that is reducing their capacity to self-regulate. So the patient needs to learn what can restore the equilibrium of his systems. And one of our tests in the regulation thermography we're doing is finding hot spots on a patient. That's what regulation thermography is about. These hot spots warn us, or these indicate the ways of organs are not coordinating or an organ is in trouble. So an integrative medical practitioner starts with the diagnosis of a patient's container of loads in the mesenchyme, so the body's inner environment. So if you have a sick tree in the backyard, you always analyze, of course, the leaves, the quantity, the quality of the crown, the branches, even the bark. But what you need to look for as well is what the roots are doing. So you dig up the earth and analyze the earth. Is the earth giving enough nutrition? Is the earth giving enough liquids to make all the metabolism, all the regulatory systems existing in a tree possible? That's what we do in humans as well. And we differ as biological practitioners from the allopathic medicine that we don't necessarily use pharmaceuticals, because pharmaceuticals are designed to suppress, destroy, or manage symptoms. But many of these pharmaceuticals have side effects that damage or other systems or even parts of our body. So the treatments biological medicine provides are very different to this approach. We have talked about the body's regulation of its systems, creating a balanced, healthy body. So the integrative practitioner trusts the body's capacity to naturally heal. Treatments boost the function of the metabolism and balance the systems, detoxify overloads in organs and mesenchyme, deliver micronutrients and orthomolecular substances, which our body uses as antioxidants and scavengers for reactive oxygen species, which we call ROS. And we also give phytotherapeutics, herbs, or stimulants for our immune system, for our elimination processes in our liver, to ameliorate the kidneys' function, and so on. So we treat the patient so the patient recovers health and well-being naturally. So the body has been revitalized by our treatments to regulate itself. And of course, it is the patient who furthers his recovery by developing a nutritional program to follow up the treatments he received at a medical center.
I'm interested in knowing how health or illness is viewed from a biological medicine perspective as compared with the allopathic medical perspective that predominates in our country.
We consider the body as a container of loads, and all the environmental toxins have an impact on ourselves. So, for example, the toxic loads of heavy metals, the toxic loads of waste products to our industrialization. So the endobiontic load we're exposed to because we're sometimes disbalanced with our intestines. These all have an impact. The stress we are exposed to working-wise or environmental-wise through our families, the stress we're going through with our peers and relationships we're having. So this is all important and plays an impact on our all-over health situation. Mm-hmm. So we are discussing actually the process of how can we optimize our regulation, our detoxification, our elimination of those toxins everyone is exposed to, because we cannot prevent us from being exposed to those toxins.
So it's really a medicine for today as compared with medicine that we have known over generations.
It tries to be in harmony with our systems. So it tries to abolish those things that have an impact or a bad influence on that regulation system, and it tries to eliminate these root causes for disease, which nothing else than do interfere with these regulatory systems we're having inside. Because our body knows if he wants to produce something, he can do this that way, that pathway, or that pathway. If two of those pathways are blocked, he knows how to regulate and turn it nevertheless into another substance. But if all three of those pathways are blocked, what is he doing? He's going to develop a degenerative disease. And by deblocking or detoxifying or taking these toxicities away, we are implementing health and healing.
And in the U.S., we talk about functional medicine. I'm wondering, how does that compare with biological medicine?
This is almost the same. I mean, you can call it integrative or biological or functional medicine. They all have the same purpose. So it would be good to find an international recognized name for this type of medicine. But also functional medicine tries to be very biologic, tries to be naturally healing. This is integrative medicine as well. But I think integrative medicine brings it to a better point, because I'm not willing to ignore the establishment of allopathic medicine, because in acute situation we are very happy to have them. So also their approaches shouldn't be ignored from our side. So there should be a mutual understanding for the body and having the purpose in mind to heal the body. It doesn't matter what type of medicine succeeds. It's normally a combination, because I even have patients that go through a cancer disease who are benefiting from both, and who are benefiting persistently from both. Not all cases, but a majority of cases that had been given up by allopathic medicine.
And if we can jump over to dental health for a moment. You know, many of us are concerned about the mercury that is in our amalgam fillings. Would you please explain why it was used and why, or whether it should be removed?
Well, first of all, I want to say that integrative or integrative medical practitioners, as you say here, consider the mouth or the oral cavity, which includes the teeth, tongue, gums, and soft tissues, including the tonsils in the back part of our hypopharynx, as an important source of information about the body's well-being or dysfunction. So the teeth are not only important, so is the tongue. So when we examine the sides of the tongue, we can diagnose possible gallbladder or liver diseases. The tip of the tongue reveals the state of the heart. The midsection of the tongue informs about the stomach and spleen. And just between the tip and the midsection, the tongue shows us about conditions of the lungs. So that's not all. In the far back of the tongue, we can discover what's going on in the kidneys, bladder, and intestines. And beyond, if your tonsils haven't been removed or been taken out, they will tell us about the immune system and its imbalances. From the color of the soft tissue, the degree of circulation and blood supply can be diagnosed. The consistency of the saliva, we can also indicate the health of the body. So it's very known that the digestion starts in the mouth, and without properly chewing, we won't break down all the valuable nutrients we need for our cell renewal and survival. But this is exactly the point, and especially in the United States. Where do we get food with an adequate nutritional value? The chewing and swallowing mechanism will create some form of satiation in our hypothalamic centers of the brain and will stop us from overeating, another problem we are facing throughout. So this makes this little anatomic space very important for our overall health and constitution. Each tooth in our oral cavity is linked with the rest of the organism. Each tooth has a separate blood supply and is reached by a nerve. So each tooth itself is a vivid organism. So, and furthermore, we connect the teeth with the meridians, which the Chinese have discovered ages ago. But in the whole body dentistry, we warn our patients about what goes wrong between their teeth and the body. We have seen the effect of tooth inflammation, dead teeth, scar tissue formation, fractured or root canal treated teeth. And this is why we have developed some wonderful protocols to prevent this from happening, being an impact on the overall health. So we try to get rid of toxic loads by supervising or keeping an eye on the restorative materials we put in. So not all are bio-inert, or not all should be used because of some toxic load inside. We try to reestablish functional harmony. If someone has a TMJ problem, a bite problem, or bite correction, that needs to be done. Bruxism, for example, is one of the most common things. So it's not only relaxation therapy or keeping in mind that your autonomic nervous system is not working correctly. It's also about keeping the damage small. So giving him night guards or tooth guards
And
overnight.
that is grinding the teeth. Correct?
Yes. We detoxify the system by supporting the liver and the intestines to eliminate the waste products and toxic load. We restore the body's capacity to regulate its cells, tissues, organs, and mesenchyme. So the whole environment within the body is going to change. And I have also examples of patients that came with the weirdest diagnosis. I had once a patient from Norway. So he came all the way down to Switzerland to see me because of a tinnitus problem. But this tinnitus problem was so aggravating him because he had to live in the woods and the mountains. He could not be among people, being shopping. So this was unbearable for him. So he came down and we made a panoramic X-ray, and we saw in his wisdom teeth area some residues from wisdom teeth that had been pulled out years earlier. So we cleaned the residues from the wisdom tooth area, which ameliorated his microcirculation in such way, or to such an extent, that this tinnitus diminished. And he, of course, could happily go back to his family living in Bergen, so no longer being out in the mountains. And this is the medicine, or the biological medicine is living from those diagnoses that are really tricky to treat or not easy to be treated or find healing.
Let alone diagnosed.
Yes, and teeth can also create chronic symptoms in a much more distant location in our body. So There might be a weak spot in a patient's knee, for example, and the experience tells us that if we deal with a persistent infection or inflammation in the surrounding of a tooth tip and don't get rid of it in the right time, that this, as we call it, disruptive focus, can become a persisting, non-eliminable load that overburdens the body's regulation capacity over time and leads to a collapse of the regulation system. In the further course, at a weak point within the body, a symptom can develop and transform into a chronic situation, and later on even lead to a degenerative disease. So this is how tooth can affect a knee even though it's a long distance from the tooth. So the teeth are living components of the oral cavity, helping us to diagnose disease in the body. In summary, body systems and teeth are intimately connected, and that's what's important for a biological practitioner or for a functional practitioner to know, that there is an interconnection. The examination, and I have the luck or the blessing that I'm a doctor and a dentist, so I'm always implementing in my general practitioner's office hours an oral examination first, before I do all the diagnostic testings for the patients to find out about the individual needs and weaknesses.
That's very interesting. So after you do the oral diagnosis, what would come next?
Well, for the oral diagnosis, it's also important the mercury issue you mentioned earlier. And I would like to focus maybe on this as well, because mercury was actually used in amalgam fillings to have an agent that allows the metal to take over some kind of plasticity for a certain period of time so that the metal material could be easily worked with. And this is what the dentists did, because amalgam is an alloy of different heavy metals like zinc, tin, copper, silver, and traces of other heavy metals like palladium and platinum, together with 50% liquid mercury. So the amalgam fillings were very inexpensive and easy to use, and dentists filled tooth cavities easily with this material of such a plasticity. So in the first 4 minutes, the dentist could shape the thinnest of gaps between the filled cavity and the remaining healthy part of the tooth. So there is no gap, and that's important in a restorative material. And then the amalgam hardens and it becomes a strong substance resistant to breaking. So we can chew on it. So it has good forces, meaning only with a drill the patient could shape it. And then the amalgam became a danger to health because they became more and more known to us nowadays. But it's still ignored. But there's research done, or has been done, a lot of research that shows that there are dangers coming out of these amalgam fillings because mercury can evaporate from the amalgam fillings, especially if we eat spicy or very hot meals, or if we smoke or grind our teeth. And then particles of amalgam can end up in our digestive tract and imbalance a proper intestinal flora, which is important to establish our health, to prevent disease. So investigations on amalgam topic lead even the Scandinavian nations, Sweden, Finland, and I know what I'm talking about because I spent time in Sweden during my medical practitioner years. So in the early 90s, they abolished or abandoned amalgam use. So even though many other countries still allow dentists to use those amalgam fillings, even there has been much research done, so it should be very clear that these are damaging factors or possible risk factors for your health. And one of those early investigations that had been done, this was a study group in Canada, they actually inserted radioactively marked amalgam fillings to mother sheep. And within 28 days of dispersion, the radioactivity was not only seen in the teeth fillings, it could also be found in the intestines, in the bone marrow, in the kidneys, in the jaws, not to say in the placenta and in the baby sheep as well. There are cadaver studies in Latin America done where they had done research on the average mercury exposure or concentration in brain and kidney tissues, and they found out that even less than 3 fillings could already accumulate the mercury content in the kidney and brain tissue that could damage or provoke neural damage, axonal degeneration, and the development of neurofibrils, or elevated oxidative stress, or hyperphosphorylation of tau protein, or secretion of beta amyloid. That's a protein that accumulates within the brain and constrains brain function. What we have in Alzheimer's, and this is a big topic nowadays. So
Yes,
there is
it
a
is.
relation to heavy metals. So these concentrations, even from 3 amalgam fillings of mercury within these brain and kidney tissue, interfere or can lead to measurable interference with the human immune cell production, with liver, kidney, and brain cell function. This all has been shown already. So, and what we also know is that there is a potentized toxic effect of mercury visible if even other heavy metals, silver, tin, copper, zinc, or lead is around. So this potentized the toxic qualities of mercury. This is why integrative medical practitioners do not recommend to have amalgam fillings. There are potential dangers to your health.
So what would you recommend now in terms of fillings?
Yeah, this is tricky to answer because we as dentists do not have any kind of bioinert material that really replaces the original. So it's always good to take care of what you have. So never get it done to a cavity you have to drill and you have to restore.
Yeah.
So with plastics, of course, which are frequently used, we have the problem of monomer. Monomer is needed to make the plastic plasticity, so to make it work, work on.
Mm-hmm.
But this evaporates as well. Ceramics is a solution, but only ceramics where we can use cement instead of a glue. We have to glue it on if we have an inlay or an overlay or a crown. So if these inlays of ceramic can be made hold with cement, then it's okay. But with a glue, this also causes other problems, advanced problems.
Sure.
So this is a tricky question because you don't have that material, so you need to take care of your healthy teeth as they are. That would be the best way in avoiding any impact on your overall health.
Yeah. So do you have any guidance for those who are interested in pursuing biological medicine as an approach to health?
Well, you see, today a resident of the United States must pay attention to reports of the Environmental Protection Agency and the environmental working groups. The land and air and waterways in the US are extremely polluted. It's difficult to avoid toxic exposure. And toxins are foreign substances that provoke skin problems, hormonal imbalances, gastrointestinal problems, inflammatory conditions, and impairment of cognitive function. So mold toxins produce many difficulties, and this is very specific for the United States because these mold chemicals can disperse throughout a room with the mere vibration of a door opening. So many hurricanes of the latest several years and flooding have increased the health risks for thousands living in the United States. And when moldy conditions have not been cleared, this is an acute problem, and that's the bad news. The good news is that we have nutrition and a regulation in us, and these are our surviving or saving graces. So natural healing is possible with the correct diagnostic tests, treatments, and follow-up program, including the will to follow certain nutritional guidelines and to commit to essential lifestyle changes. The Biological Medical Network at the Marin Institute is online and provides information about that, and even lists practitioners in the US that can help you with going through those alternative treatment options. But for those that want to take advantage of getting away from home, being surrounded by the beauty of the Swiss Alps and Lake Geneva, they are welcome to my practice, of course, and can find a unique healing environment alongside with an optimal individualized care. There we provide preventive medical care in addition to care for recovery from degenerative or chronic illnesses by eating certified organic vegetables and fruits and changes in their lifestyles. So they cut down eating processed foods, red meat, dairy products to reduce toxins, aggravating the body's effort for balance. And that's what it's about. If you find your balance, you will heal and you will even prevent disease. And this is what the take-home message should be, that take care of yourself. Be ready for self-responsibility. Try to support their self-healing forces in whatever ways are there for you, nutrition-wise, psycho-emotional-wise, constitution-wise, because I believe in a body-mind-soul concept. So we're having all the organs that are interlinked with and work together with each other. We're having the intercellular communication. We're having a soul, a constitution, which is given to us by our ancestors, by our mothers and fathers. It's the genetic history we have. It's the detoxification capacity. It's the capacity to deal with oxidative stress. And we have the mind. There we have the psycho-emotional issues we are daily dealing with in our working environment, in our private family environment, but they influence our autonomic nervous system, our parasympathetic and sympathetic qualities. And they are subconsciously somewhere in there, because when we sleep, we might be very tensed and we are, repeating our daily life. So this has an impact on our development of diseases, because we want to prevent being always tensed. We need a balance between being relaxed and being out there in the world, in the orbit, to take information. So balance is very important, because this helps our regulatory systems to recover and to prevent disease.
Absolutely. And so people would be able to learn more by contacting the Marian Institute? Is that the
That's
best
one of the
way?
messages I'm giving. Yes, they can contact the Marian Institute or other healthcare practitioners in the surrounding. There is Dr. Habeck in Watertown in the Boston area, very highly recommended. And of course me in Switzerland, so there's always a possibility to contact me via email, f.pleus@hotmail.ch, or even contacting me via phone. For the United States listeners, it's 011-4121-925-1500.
Well, thank you, Dr. Pleus. It's been just such a pleasure having you here. And I really wish we could talk longer.
Thank you very much. The pleasure was on my side. I'm very pleased. Thanks.
I hope you enjoyed the interview. For more information on Dr. Pleus, you can visit drrouseway.com. For more information on the Marian Institute, you can visit them on the web at themarianinstitute.org. Thank you for joining us today. I'm your host, Sheryl Worthington Turgeon. See you next time on Living Healthy.